Hello, my name is Sam and I'm going to talk about a behaviour modification intervention for nail biting. Nail biting has been described as a nervous kind of habit which involves repetitive, manipulative behaviours that occur when a person experiences heightened nervous tension, like me now. One of the behaviour modification treatments for nail biting is habit reversal therapy. Habit reversal therapy has 4 components: awareness training, competing response training, social support and motivation procedures. We will look at each of these components more closely and then I will talk about implementing the intervention. Firstly, awareness training. This involves being aware of each time that you actually bite your nails and what was happening immediately before and after the biting occurred. In order to do this, you can write down the time, date, who was present and what was happening when the biting occurred. You can put a foul-tasting substance on your nails to actually alert you to the fact that you are biting. These procedures will help you to learn to identify when the biting occurs and when it is about to occur. Secondly, the competing response component involves, once you have identified when you are about to start biting, this is when a competing response is implemented. A behaviour incompatible with the biting, such as clenching your fists for just say 20 seconds to 1 minute, actually competes with you being able to bite your nails. Can't bite your fist. Another method to serve as an alternative behaviour that has the same function as chewing is to chew on a toothpick or chew a piece of gum. As nail biting has been described as a nervous habit, it can be beneficial to implement some simple relaxation techniques when you are about to bite, such as diaphragmatic breathing to alleviate anxious feelings. You breathe deeply in a slow, rhythmic fashion. Each inhalation, the muscles of the diaphragm are used to pull oxygen deep into the lungs. This competes with the shallow, rapid breathing that anxiety produces. Diaphragmatic breathing decreases anxiety by replacing this breathing pattern with a more relaxed pattern. We can now move on to the social support component. This can be implemented by informing those who live with you and work with you, anyone that is close in your circle, that you're actually trying to cease nail biting and if they can actually be supportive in your efforts to do this. They can, if they actually see you biting, they can ask you to implement your competing response behaviour. For the motivation component, it is useful to list all of the negative aspects of nail biting for you. This could be broken skin causing pain, ugly hands, bacteria transferred from nails to the mouth, the transference of intestinal worms from the nails to the mouth. These are an example of some of the negative aspects of nail biting, which can increase your motivation to applying and continuing the habit reversal therapy. With this knowledge, you can now start your intervention. Firstly, set your goal and criterion level, such as completely ceasing nail biting to 0 frequency within a 6-week period. Defining the behaviour. Is 1 episode of biting defined when the fingers go past the plane of the lips? Have a baseline period before implementing the habit reversal therapy. Record the frequency of biting for 1 or 2 weeks. Carry a notepad and pen with you at all times to record each instance and what you felt and what happened before and after the biting occurred. This is also your awareness training component of the intervention. You will be aware of what is functionally related to the behaviour. For example, do you feel anxious before biting? You are also learning the consequence of the behaviour. Does the biting relieve anxious feelings? You can now apply your competing responses to the behaviour. Don't forget to implement your social support. Put your motivation list where you can see it, maybe on the refrigerator, on your office desk, on your computer screen. Keep recording each instance of the behaviour until your goal and criterion level are reached. Once you have reached the time limit of your intervention, then you can compare your baseline frequency against your intervention frequency and determine if the intervention had any effect at all. I hope this may help you to give habit reversal therapy a go in trying to kick the habit of nail biting. Bye for now.